Right now, California has one of the best COVID case rates in the country, but experts are seeing signs that things could change and it could happen quickly. Good evening. I'm Kimberly Hunt.
And I'm Steve Atkinson. Our ABC 10 News anchor Derek Stahl is going in depth to reveal the challenges other states are now seeing and how we can avoid them.
Just under 63% of Californians are now fully vaccinated, good enough for the 14th highest rate in the country. But just a few states over, Colorado has an identical vaccination rate, and its hospitals are overrun with COVID cases. Colorado has switched to crisis rules for its medical staffing, and there's concern its hospitals might have to start rationing care by the end of next month.
Time and time again, when you underestimate this virus, you get burned, and we are at risk of that same thing happening to us in California going into the winter.
Dr. Christian Ramers of Family Health Centers of San Diego says a 63% vaccination rate still means roughly 1/3 of the population is extremely susceptible. And with waning vaccine immunity, a smaller group is at risk of a breakthrough. In Colorado, 80% of hospitalized COVID patients are unvaccinated.
It's colder there than it is in California. People are moving indoors more quickly, kind of earlier than us. And you're seeing what a real winter surge looks like in a place with decent vaccination rates. We could be right there after the holidays and people all get together and transmit within their own families.
To be sure, Denver's average winter temperature is 19 degrees colder than San Diego's, but UCLA epidemiologist Dr. Anne Ramoyne says Southern California has its own risk factors.
We have a lot of crowding, we have a high social vulnerability index, and so we've seen surges here in Southern California because we do also have people living in close proximity to each other.
She says with more people indoors, vaccinations have to be fortified with other measures like masks and rapid testing. Even the most vaccinated state in the country, Vermont, is seeing a rise in cases. Overseas, the UK has the third most active cases in the world. Its vaccination rate is even higher than California's, but there is one big difference.
And what the UK failed to do was vaccinate younger adolescents. And that's the population that sustained transmission and is causing all the problems now.
UC San Francisco epidemiologist Dr. George Rutherford says the UK authorized vaccines for 12 through 15-year-olds about 4 months after us. At one point last month, school-age kids in the UK were more than 10 times as likely to be infected as the country's seniors.
What's at the root of this is not vaccine failure, waning immunity, or anything like that. It's failure to vaccinate.
Experts say new data out of Israel shows booster shots can significantly slow the spread, and the extra protection starts taking effect quickly, within 48 hours of the shot, just in time for Thanksgiving. Derek Stahl, ABC 10 News.
There's already a COVID surge in Central California, and it's become so dire that health officials are pleading for permission to move patients to hospitals in other parts of the state. Vaccination rates in cities such as Fresno are lower than ours in San Diego. Officials say hospitals are so flooded with COVID patients, they often have to divert others who need emergency attention, and they're calling for state action to make it easier to transfer patients from Central California to cities with open hospital beds such as LA and San Francisco.